All right, check, check, check. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. sure to mute your phone until it is your turn for a question.
Ready? Good morning. I'm Dr. Clay Runnels, the Chief Physician Executive for Ballad Health. And, Jamie Swift's been given a break this morning, so I'll be giving the report that she normally gives. Our local COVID update is, as of this morning, we have currently 15 patients with coronavirus who are receiving care in our facilities. We have more than 300 beds available in dedicated COVID-19 units in our hospitals, and all the necessary PPE and resources to care for those patients. While we are seeing fewer diagnosed cases right now, it's still important that we continue to practice social distancing as a community to help prevent the spread of disease. I think that the social distancing has been showing a positive effect on the community as we are seeing fewer cases. And I'd like to thank those who are adhering to the stay-at-home orders, which have helped accomplish that task to this point. We're not out of the woods yet, but it's really important. So it's really important that we continue to do the things like stay at home and social distancing. I do have an important message today with regard to life-threatening symptoms that people may be experiencing. There's an alarming trend nationwide that healthcare professionals are very concerned about with regard to people not seeking necessary care when they're having serious symptoms. Many of this are referring to it as a silent sub-epidemic within the pandemic that we're experiencing. And while it's important to be cautious and limit your potential COVID-19 exposure, it's also vital that you seek care when you need it. If people ignore signs for heart attacks and strokes, for example, the outcome can lead to permanent disability or death, and conditions like appendicitis, obstructed bowels, and gallbladder disease, if untreated, can lead to more extensive surgeries, long hospital stays, or even death. When you're experiencing a health emergency, getting critical care in a timely fashion is very important. Overall, Ballad Health emergency departments have seen a 51% decrease in their visits over the last few weeks. Also, in Washington County, Tennessee, EMS reports decreased number of calls for chest pain, shortness of breath, abdominal pain, and stroke symptoms. Now, some of this decrease is likely due to social distancing and stay-at-home orders and people potentially participating in fewer high-risk activities, but some is definitely due to avoiding necessary care. It's really important that we all know how to recognize the signs of a health emergency and seek care when necessary. For example, a heart attack will often show signs of pressure or tightness, squeezing in your chest, nausea, heartburn, shortness of breath, cold sweats, sometimes even fatigue and lightheadedness. With stroke, patients can experience balance difficulties, eyesight changes, speech difficulty, and weakness in your face or arm. If you're experiencing any of these symptoms, I implore you to call 911 or to seek care in your nearest emergency room immediately. Also, it's important to not delay more routine care, which can prevent these kind of illnesses. And it's important to remember that we do have connected care with Ballad Health, and most of our providers are on this telehealth platform now and available to you. We also have telehealth urgent care available if that's something that you need. If you're a Ballad patient, I encourage you to call your provider if you have questions or a medical condition that needs to be addressed. If you need medical care, please don't put it off because you're concerned about contracting COVID-19. We have, Ballad Health has steps in place to protect you, including screening for all visitors, providing masks for patients, visitors, and our team, and visitor restrictions. So in summary, it's really important that if you have symptoms of a serious illness that you don't put that off because of a concern over being infected with COVID-19. I'd also like to take a minute just to thank our media for joining us for this press conference today, and also thank our team members on the front line who are doing an amazing job. And I'll introduce now Eric Deaton, our Chief Operating Officer.
Good morning. I'll say thank you to Dr. Reynolds. I really appreciate your leadership as you have been helping lead the COVID-19 responses in our region. So it's very much appreciated, Clay, and thank you for all that you do for our organization. Also want to thank our media for being involved. I want to thank our team members for all that they do every single day. And especially want to thank our community today for the work that they do in providing us contributions and support that they provided through these last several weeks that we've been addressing COVID-19 in our region. Let me give you an update on our lab. I want to provide an update regarding lab supplies especially. We've received 4 new Cepheid devices for rapid testing of COVID-19. This is really important. Those testing devices will be placed geographically across the region, and will really, by adding these additional this additional equipment, we are now able to do approximately 400 tests per day in-house, which is really valuable as we diagnose and treat patients across the region. These units will be brought online by tomorrow, and so our in-house testing capabilities will greatly increase by tomorrow. This new device runs 4 tests at a time, which is 8 per hour, again, which really boosts our capacity. We had already had this technology in place with before the coronavirus hit our area, which is why we've been allowed to really expedite bringing this online. So now we've actually doubled the capabilities that we have within our organization. Secondly, I want to talk to you about non-emergent procedures and surgeries. As you probably remember, on March 20th, Ballad Health stopped doing and performing all non-emergent procedures and surgeries. This was in response to the federal guidelines and the order from Governor Lee in Tennessee and Governor Northam in Virginia. As Tennessee prepares to reopen the economy, Ballad Health is participating in the state's economic work group and the Tennessee Chamber. And what we're doing is providing input on how to safely start doing non-emergent but very important surgeries and procedures. Ballad Health has developed a recovery team that's led by Dr. Beth Jackson, a general surgeon in Kingsport, and Rebecca Beck, who is a surgical services line leader for Ballad Health. Working with a large team of physicians and other leaders across Ballad Health, they'll be working closely with all of our physicians and leaders to help develop protocols on how to start providing non-emergent surgeries again in our region. This criteria will proceed. The criteria to proceed with procedures will include appropriate screening of patients and an assessment of adequate personal protection equipment, or PPE, as we've talked about before. And we'll be providing additional details as we continue to evaluate what's best for our patients, for our team members, and for our community moving forward. Finally, today I want to talk to you, as I did a few days ago, about a mission moment that we've had recently. One of our RNs, nurses, Mindy Juarez, had been doing some research around COVID-19 patients and what provided them comfort. And she found out that providing hot tea, hot coffee, things like that, from patients suffering from COVID-19 really provided them great comfort. And so every shift she would come in and make hot tea for our patients and provide that to them to provide comfort for them, which is just a wonderful thing. Very thoughtful, something that she wouldn't necessarily need to do as a nurse at the bedside, but something that certainly provided great comfort to our patients in the COVID unit. When you're in one of these units, you oftentimes feel isolated and scared, and so I think that Mindy, by providing this great service, was able to show great compassion, and I just want to say thank you, Mindy, for all that you do to provide care to our patients every day. At this time, I'd like to introduce Alan Levine, Chairman and CEO of Ballad Health. Alan?
Thanks, sir. Good morning, and thank you. I want to just summarize a couple of things that I think are critical. Number one, yesterday it was announced that the governor was not renewing the state's safer at home order. I support the governor's decision. I feel that he used the appropriate balance. The issues here aren't just the spread or potential spread of this disease. It's also the mental health effects and the reality that people are really struggling. And how do you balance those two issues? And I think the appropriate thing to do has been to look at the guidance, understand which parts of the state are really heavily impacted, which ones are not as impacted, in our region simply because of how well people have responded and done the social distancing. Obviously, you could always say we could do more, but the reality is that we've seen our ability to manage this simply because we haven't seen as much of a spread as we could have if people had not followed and heeded those orders. So commend the governor and his staff for the work they've done. Also commend them for the steps they took to do the broad testing last weekend. I think that data will be very helpful. Hopefully everyone that wanted to be tested could go be tested. I think that that was a very, very helpful move. As Eric mentioned, we have a recovery team that we appointed early last week to look overall at the recovery issues affecting Ballad Health. Not just, how do we ramp up surgeries and diagnostic procedures and other procedures, but also how do we recover financially from the extent of the damage that's been done and continues to be done to health systems and hospitals all over the country. We're watching very closely. Today, a story came out that Envision, which is a company that we don't have a relationship with, but it's a company that provides medical staff services to hospitals all over the country, that they're actually exploring the potential for bankruptcy. We think there's a lot of very, very serious impact that's going to be seen throughout the country. And because of that, we're grateful that the federal government has moved as quickly as it has to try to deploy some of the resources to the communities, to the hospitals, and to the healthcare providers that are out there. Eric mentioned the rapid testing capacity. We've been talking about this for weeks, feels like months. Ballad is the first health system in the state to have the rapid testing capacity that we began almost 2 weeks ago. And now we're certainly far ahead of everyone else in terms of expanding that capacity. That is a critical step towards reopening our elective surgery procedures. One of the things that's critical for us is that we have the capacity to test patients who are potentially affected before we possibly expose our teams. So having this expanded testing capacity is a very necessary first step, and I'm proud to say that Ballad again is leading the way in terms of making sure we've got that capacity so that that necessary step is taken before we start expanding or reopening our elective procedures. We'll have more to talk about later this week on the elective procedures, but the most important thing is that our physicians, our surgeons throughout the region know that we are taking a very methodical approach to this, and first and foremost getting the input of surgeons, anesthesiologists, and nursing leadership before we make any decisions about how to on-ramp these procedures. There is a large pent-up demand for these procedures, and we want to make sure we properly prioritize the procedures that go first and that we do it in an efficient way so that we can get everybody back on a routine rhythm. I will say we announced earlier the research project that we're participating in. Proud to say that we've treated 5 patients with the plasma as part of the research project with no bad effects from the use of the plasma. Obviously, over time, we'll determine what the effect of that was, and we'll report that up through the study as required under the IRB. I'll close with this. Dr. Runnels mentioned the decline in ER visits that we've seen. That was to be expected. Part of why we wanted to push the virtual urgent care out there when we did was to make sure that people who have any type of symptoms, if you're concerned about going to the hospital, we understand that. We believe it's a safe environment, but at the same time, if you're concerned about that and you're having any types of symptoms, call 911. But if for some reason you still don't want to do that, get a hold of our virtual urgent care so that you can be assessed by a clinical professional who can give you guidance. If that person hears your symptoms and determines you need to get to an ER, heed their advice and get to an ER. We saw the volume and we wanted to validate what we were seeing, so we went and got from the Washington County EMS just some data to see if they could validate what we were seeing, and certainly their data 100% validates what we thought was happening. They've seen a 45% reduction in their calls some of the calls that we've seen a very significant reduction, things like chest pain, end-stage renal disease, other types of conditions that you don't want to play with. If you are having chest pain, if you're having stroke symptoms, if you have other symptoms, if you have a chronic condition and you're experiencing symptoms, you need to get help. And in triaging your own health, it's more important to deal with those potential emergency situations so that you don't end up with an outcome that's preventable, a bad outcome that's preventable. So we want to, these hospitals are there for you. The ERs are there for you. They're staffed and they're prepared to take care of any condition. Please utilize those services if you find that it's necessary. I'm going to close it up with that and answer any questions you might have.
All right, we'll go ahead and open it up for questions. First on the line, we have Richard Lovett with Cumulus. Richard, do you have any questions?
Yes, Alan, good morning. Thank you as always on Tuesdays and Thursdays. Regarding the governor's plan in Tennessee to reopen, can you touch on any concerns you may have on this in terms of maybe too soon, too fast, or are you pleased with his methodical approach here?
I'm very pleased with how he approached it. It's a balanced approach. He didn't come out and say, boy, we went too far, or this is ridiculous. He came out and said there's a valid public health reason for people to socially distance themselves. And he doubled down on that. And I think he's trusting Tennesseans to make good, responsible decisions for their health and for the health of the people around them. And at the same time, he's saying the economic health of our state is relevant. There's going to be another crisis that follows this, and that's going to be a mental health crisis. People are losing their earnings. They've lost their jobs. They've lost their savings. And a lot of people are unsure about their future right now. And that leads to all kinds of behavioral and mental health issues that we've yet to see. In fact, even looking at the EMS calls, we've seen a 50% reduction in altered mental status, behavioral and psychiatric episodes. We've seen a reduction in that, but we know that the incidence is actually higher. And so our concern is that there's a need out there by people who've been affected by this, whose needs aren't being met currently. I think the governor approached this the responsible way. I don't know. I don't know what it's like to be a governor and have to weigh all these things. I imagine these things weigh very heavily on him. I have served two governors who went through this, and the issues are the same. You have to balance people's mental health, their behavioral health, and their ability to make a living for their family with the public health implications of all this. And I think he did that, and I think he did it well, and I think he did it in a methodical way. Last Friday, I was on a call with the governor and with Stuart McWhorter and Commissioner Piercy. The governor himself engaged in that discussion. He didn't delegate it to staff. He himself was engaged with us, asking us questions, hearing our input, doing a lot of what-if scenarios. So he was listening to the people who are on the front lines experiencing this, and I couldn't be more grateful for that, because he's not just relying on staff or advisors. By the way, he has very good staff and very good advisors, but he himself wanted to engage with us, and you just can't ask for more from a governor.
Richard, do you have an additional question?
Yes, follow-up. In light of that, Alan, can you express how important it's going to be for folks when the economy does reopen to keep up social distancing and to not let down their guard?
That was an important part of the governor's message, and I could not echo that more loudly. Just because the governor is recognizing the need to reopen the economy, it's not a zero-sum game. He also recognizes the need to continue social distancing until we have a vaccine and until we have proven cures. I mean, this is a virus, and it's a dangerous virus. And so we are going to continue to talk about the need for social distancing. I think it's going to affect the behaviors of businesses that reopen for a period of time. Certainly restaurants that reopen at the time that they do, you're probably going to see a difference in how they seat customers within the restaurant. That's all very smart and appropriate. And I think I think we can find the right balance here. And I think if we do it well, it'll continue to reduce the potential surge on the health system. At the end of the day, the concern is the same. The concern is you don't want to have such a growth in this disease spreading that the health system can't handle it. And at the end of the day, we Ballad believe that we're in a position to be able to handle our region based on what we currently see. That can change quickly if we don't heed the governor's advice and respect the need to socially distance ourselves until we get through this with a vaccine.
Thank you, Richard. Next, we have Bianca Morera with WJHL. Bianca, do you have any questions?
Hi, yes, thank you so much for having me. Yesterday, you announced a partnership with both Ballad Health and the Washington County CMS in the event that our region sees an outbreak on a much larger scale. I was just wondering, what is Ballad's involvement? How did the arrangement come about? And what will this partnership mean in the region in the case that we do see a drastic increase in cases?
I'm sorry, I missed the first part of your question. Can you repeat that? What partnership are you referring to?
Sure, I was referring to the partnership that ETSU yesterday announced with Ballad Health and the Washington County EMS with regards to pooling resources. ETSU said that they would be allowing their dorms to be used for first responders and healthcare workers in the event that our area is overrun.
Yeah, no, that's something we've been working on with ETSU from even before, back in the middle of March. Dr. Noland and I had a conversation about the ETSU plan and what the Ballad plan was. And ETSU was gracious enough to offer Ballad and other first responders the use of dormitories in the event we see a surge. And as I understand it, the purpose for this is in the event we have a surge and a high exposure rate within, or potential for high exposure rate within the hospitals, our staff who are working can use the dorms for their own housing so they don't go home and potentially expose their families. And we're grateful that ETSU has offered that. That's been part of our joint efforts together to plan, and we continue to have ongoing direct dialogue with ETSU. There's 100% partnership between Ballad, ETSU, and what you've heard about with respect to ETSU's outreach with the EMS. That's all part of the planning that we've been doing with ETSU.
Bianca, do you have a follow-up question?
Yes, I was just wondering what kind of impact do you think this might have in that event that we possibly see an enrollment surge in our area?
Well, obviously, it would be a significant impact if there's a surge, so that we can protect our team members and their families. So we're grateful for the work ETSU's done on that. We certainly appreciate the close partnership we've had with them.
Thank you, Bianca. Next, we have Trey Adams with WXBQ. Trey, do you have any questions?
Yes, good morning, Alan. Over the weekend, there were over 11,000 tests distributed across the state of Tennessee. How closely are you all watching the numbers from the statewide testing, including in this area where I believe around 1,300 people tested for COVID-19?
Yeah, I think, first of all, it's great that the Department of Health was able to organize that. That's fantastic. I think the data that'll come back from that will be very informative. You know, we'll finally be able to see what has been the infection rate. And then that can help inform us going forward, because you now have a large denominator. You have a statistically significant sample that isn't just people that have been screened. It's people of all types that came and got tested. So I think it'll give us some really good data to make some good policy decisions from. And I really appreciate the governor. One of the things we've been saying to the governor has been it's important to get testing and to expand testing. And as Eric shared with you earlier, Ballad has been at the sharp arrow's edge of this with testing. We from the very beginning have been pushing hard to get rapid testing to our region. And for a long time, we were the only region that had it. And that has helped us decrease the risk for our team members and decrease the risk for patients. So I commend the state for doing it, and I'm looking forward to seeing what the data will show.
Trey, do you have an additional question?
Oh, I tell you what, I mean, Ballad Health, because of the nature of Ballad Health, we are in a much better position in terms of our ability to respond to this, our ability to sustain our rural hospitals through this. I think if there's been any specific thing you can point to, and frankly, I think there's a lot of them, but this is one area in particular where the benefit of Wellmont and Mountain States coming together has manifested itself in benefit to the region beyond anything we could have even expected. Our ability to plan and execute and involve and include the entire region in that planning has enabled us to be more efficient and be more responsive to what the needs of each of these communities has been. Whether it's seeing an outbreak in Hawkins County or having a surge plan for Wise County, Virginia, or coordinating the assets we have in Johnson City and Kingsport so that we can treat people, to starting a research study, I mean, with our own blood bank. All of these things combine to create incredible benefit. We've seen in the last 2 weeks one major rural provider declare bankruptcy. Several rural hospitals are within 2 pay periods away from running out of cash. I really think that we're in a better position. And I will also say, because of the way we've managed our supply chain under Eric's supervision with Dale Clater and Brad Price and others who have been managing our supply chain and our lab testing, because our supply chain has been so reliable and our lab testing has been so aggressive, we're now in a position to have a good plan for restarting our elective surgery procedures. Those 2 things are critically important. Having the PPE and the supplies on hand to start doing surgical procedures, and then to have the lab testing, the rapid capacity to do the rapid testing, are 2 very critical factors for ramping up your surgical procedures. And frankly, we're in a position to do that because of the unique nature of Ballad. And I will say, as the postmortem is done on all this, I think people will look at how Ballad responded to this and say it was because of our ability to plan and execute that we were able to move as quickly as we were on some of these areas.
Thank you, Trey. Next, we have Brittany Nave with the Elizabethan Star. Brittany, do you have any questions?
Yes, I do. In regards to rapid testing, I was wondering how long it will take for results to come back for these tests.
We can get the results on rapid tests. They process within the hour, but what we're doing is we're batching them. So it's usually within 5 or 6 hours we can have the result. And as we perfect that process, it could get even faster. We're going to want to move quickly as we start thinking about ramping up procedures. We're going to want to have those results as quickly as possible so that we can move those procedures to the next phase of their treatment, which is to get them into the operating room or into the diagnostic suite so that we can start doing those procedures as quickly as possible.
Brittany, do you have an additional question?
Yeah, in anticipation for the governor reopening studies at the beginning of May, are you all prepared for an increase in ER visits once people start coming back out?
Yes.
All right, thank you. Thank you, Brittany. Next, we have Caleb Herney with WCYB. Caleb, do you have any questions?
Yes, Alan. During this time when we've been talking about trying to reopen, there's been one of the markers, even with the present guidelines, to have declining cases for 2 weeks. The number of new cases has largely been flat for a while since but hasn't declined very much yet. Has the situation changed? Do you worry about a resurgence will come back?
Well, look, I do believe you'll see an increase in the number of cases once you reopen the economy. I think that's it's just logical to conclude with more people interacting, there will be some additional spread. So I think you want to see a decline in cases generally, but you also want to see that you've got the capacity. And that's what's driven the policies. Does our health system have the capacity to serve people who are affected by the virus? And right now, we believe, based on our models, that we are in a position to be able to take care of people if they should be exposed to it. I think again, there's no perfect answer here. You can't go to either extreme. We're never going to reopen the economy, or we're going to go full guns with the economy. I think the right answer is we're going to reopen the economy and encourage and continue to educate people on the need for being smart with how they expose themselves to other people. Look, if you're over the age of 60 or if you have multiple comorbidities that are known to exacerbate the condition, then even with the economy reopening, there's going to be a lot of focus on educating you on it's important for you to continue to stay at home unless you have the need, for instance, to seek medical care or to handle your personal needs. You know, again, the idea here is to focus on populations that are at risk and to minimize the risk for those populations, while at the same time trying to reopen our economy and get people back to work again.
Thank you, Caleb. Do you have an additional question?
Yeah, so I wanted to ask, it was the other week here that announced furloughs and talked about that with the lower for elective procedures and things like that, that it was a dire economic outlook. Does reopening now change anything with that furlough or with the economic outlook for you guys?
Well, right now the outlook is not great. We're going to be reporting here soon our quarterly financials for the quarter that just ended, and we'll record a pretty significant loss. And in the fourth quarter, we project that there will be a very, very significant loss. Now, of course, that's without knowing what additional support will come from the federal government, and we certainly are very engaged in that. As it relates to the furloughs, we will, as we consider, and this is what Eric and his team are focused on, as we look at reopening our elective procedures, clearly there's going to be a need for clinical staff to be recalled. And if you recall, when we did the furlough, we did say that at any time we can recall you. And when you're recalled, we certainly expect that you'll come back so that we can provide the services that our community needs. So I think as it relates to our frontline, if you recall, we kept all of our bedside nurses, RNs, LPNs, certified nursing assistants, and respiratory therapists. We've been guaranteeing their hours, so they've not been furloughed, the direct bedside staff there. The other team members that have been furloughed, our OR staff, other parts of our team that were severely impacted by the decreasing volume, there will be a need to recall some of them, and that is part of the process that we're going through right now to determine whom to recall, how many people we need to recall based on the expected volumes, and of course we'll communicate that directly with the team members at the right time.
Thank you, Caleb. Next we have Jonathan Roberts with the Johnson City Press. Jonathan, do you have any questions?
Yeah, I do. First, I want to talk a little bit more about that ER visits. How important is it for Ballad to make sure that those people are still getting the care that they need when they have, sharpness in their chest, any shortness of breath, or appendicitis potentially?
I'm going to answer that question, but I want to add one more thing from the previous response I gave. It was a lot easier to close down elective procedures than it is to reopen them. When you shut down all of your elective procedures, your surgical procedures, your diagnostic testing, when you close all of that down, you can do that with a flip of a switch. But once you've done that, you create a pent-up demand for those services, and onboarding all those services without overwhelming your facilities becomes hard. And so there are a lot of moving parts. How do we protect our team members in terms of PPE and testing? How do we how do we infuse a testing requirement into doing the testing before a patient goes for a procedure so that we don't unnecessarily expose staff members? All of these things have to be added to the equation. So I just want to make it clear, reopening is not as simple as it was turning it off. Turning it back on takes a lot of work and a lot of planning and a lot of agility. And that's why we've got physicians, anesthesiologists, surgeons, nurses from all over the region providing input to us on how to do it. The question you just asked, how important it is for Ballad, look, I can't think of anything more important. We have done, I think, a really good job of communicating to people how important it is to socially distance themselves and to stay at home. In fact, it was ordered by the governors of Virginia and Tennessee for people to stay at home. But one of the things that we want to make sure people are aware of is if you exhibit symptoms, you know, a heart attack for an elderly person can be as deadly as the pandemic or even more deadly. And so if you are experiencing chest pain, if you're experiencing stroke symptoms, if you're experiencing symptoms, acute symptoms related to a chronic illness that you have, don't put off getting care. Either call 911 or go to the closest emergency department, or if you feel uncomfortable because you're worried about being exposed to the virus, call our virtual urgent care phone number and seek the guidance of a healthcare professional who can hear your symptoms and give you the best advice. And that advice may be, you need to go to an ER right now. And if they tell you to go to an ER, I would encourage you to do that as quickly as possible. What concerned us about the numbers, to see a 50% reduction in ER utilization, you know, a lot of that's to be expected. You're not going to have as many car accidents. You're not going to have as much trauma. You're not going to have as many incidents that require that type of ER care. But to see a 50% reduction in chest pain, I'm not convinced that there's been a 50% reduction in chest pain. I'm convinced there's been a reduction in chest pain, but there are chest pain patients who've experienced it who haven't gotten the help that they might need. And the net result of that can be a really bad outcome. And so we just want to make sure that people rely on the healthcare system for their healthcare needs and don't put off needs that may be emergent.
Jonathan, do you have an additional question?
Yeah, my second question is kind of building off of Caleb's previous question. You know, how much will the stay-at-home order being lifted affect Ballad?
Hard to say. I mean, I think there's you know, we know there's going to be a surge in cases, and so we're preparing to manage through that. But we don't know what human behavior is going to look like, particularly for the population of people that are high risk. As they should, they're going to continue to socially distance themselves. Many of them will continue to stay at home, as they should. And what does that mean in terms of our elective procedures? There might be patients who say, you know what, I know I was going to have that knee replacement, but I think I'm going to wait for a while. And of course, the more of that we see, the more obvious impact that has on Ballad's volumes. And so right now, there's a lot of unknowns about what this will look like. We do think it's reasonable to conclude that we will see a surge in volume, and we're going to have to manage that. And we would ask, and I think Eric would repeat this, and he'll probably talk about this more on Thursday, we're going to ask for people's patience as we try to onboard these procedures, because we do have to come up with a mechanism for prioritizing what goes first. And the priority is always going to be driven based on what is in the best interest of the patients who have the most needs. And that'll always drive our decision making, and certainly that'll play a big role in which cases are likely to go first.
Thank you, Jonathan. Next, we have Richard Rourke with the Irwin Record. Richard, do you have any questions?
I'm good, thank you.
All right. Next, we have Eugenia Estes with the Greenville Sun. Eugenia, do you have any questions?
Yes, just touching back on the PPE. I think a few weeks ago, it was announced that you have the technology to re-sanitize the face mask. And I was just wondering how that process is going.
You want to talk about Eric? I'll have Eric come up and talk about it. He's been directly involved in that.
Yeah, thank you for the question. So we have started actually today to start with that reprocessing. And it is a process where you also have to identify who used the mask before. So there is a lot of details around that, but that's starting. We're also partnering with some of the other providers in the area, such as ETSU and SOFA, HMG, others, to help them with reprocessing of their masks. And so we believe we can reprocess those 3 times, and they can be used again. Our plan is to actually reprocess those masks, set them aside, and use them in the event we have a surge, and utilize new masks until we run into a point where there's a crunch or a real need to utilize those masks that have been reprocessed.
Yeah, that's an important distinction Eric just made. You know, our goal is to use the new masks. But if we run into a surge situation, that's where the guidance says the use of reprocessed masks is acceptable to the CDC. And so I think that's an important distinction to make, is that our preference and priority is to use new before we use reprocessed.
Eugenia, do you have a follow-up question?
No, thanks. No, thank you.
All right, thank you. Next, we have Blake Lipton with WJHL. Blake, do you have any questions?
Yes, I just want to read something from a release we have received from Ballads last Friday, I believe. It says, we are lagging behind other parts of the U.S. in our physical distancing efforts, especially in reducing the number of visits and time spent at non-essential locations. No county in our region has decreased non-essential visit activity by more than 45%, and most counties have reduced non-essential visit activity by less than 25%. This is not enough to slow the spread of COVID-19. So my question would be, wouldn't it be reasonable to infer it will continue to get worse with reopening the economy?
Well, as I said, I think we can expect to see an increase in the number of cases as more people interact with other people. That's likely to happen. I will say, and again, going back to that release, you know, from the very beginning, Ballad Health has not relied on these national models. And we internally and at these briefings, we have said, we've been looking at our own region, the uniqueness of our region, the rural nature of it, the distance that people live apart from each other, and trying to estimate what we think the spread will look like here. The model that press release references is our own model that we're taking details and applying technology that sort of, it's not geomapping. Is it the geomapping that we're using? The movements of cellular technology to determine, are people going to non-essential places? And we're using that as sort of a guide to say, are we doing a pretty good job of reducing the social distancing or improving social distancing or not? You know, it's the most scientific thing we have to use. And I think for transparency's sake, it's important to share that information. I think once you reopen the economy and you have people increasing their interactions with each other, there's certainly a chance that there's going to be an increasing number of cases. I believe that Ballad is in a position, based on what we currently see, that we can handle any number of cases that do come to us for help. So I think this is part of the balance the governor has had to make, and I support his approach.
Blake, do you have an additional question?
Yeah. Is this going to affect the way you do anything else? I know you had talked about possibly elective procedures. Do we have a time frame on that? If there is anything else that reopening the economy could change what Ballad does going forward?
Well, we'll talk more about the reopening of procedures on Thursday. There's a team that's been working on that with physicians and staff and nurses and anesthesiologists from all over the region. And we're going to let science guide that process. And Eric will talk more about that on Thursday. Right, Eric? Yes. Eric will talk more about that on Thursday to provide guidance to our, the primary audience with this right now is our physician community who are communicating with their patients. And so we want to make sure we're communicating with the surgeons, with the doctors, what our processes are going to be so they know what the rules of the road are for getting their procedures done. And I think most doctors agree with prioritizing cases based on what the needs of the patients are first. And we're planning to do that. So beyond that, I don't want to speculate about how all this will impact Ballad, other than we're watching the number of cases. We're watching to see what happens. And if we get to a point where we think we can't manage the capacity, or we can't manage the number of cases, we certainly will say that, and we will publicly encourage people to slow down their interactions with other people, and we'll communicate that with the governor as appropriate. But right now, I think because we've seen a relatively low spread, that we've got the capacity to manage it. I think we're in a position to endorse reopening the economy and getting our people back, getting these small businesses open again. And I can't overstate this. the effects on people and their families from the economic devastation that's happened in many cases is just as devastating as the disease itself. And we can't, I mean, this is going to be what I think is forthcoming after we get through this. I think there's going to be a lot of need to interact with people based on how this has affected them emotionally. And I think we have to make sure that we tell people it's a sign of strength to seek help and to talk to somebody. It's not a sign of weakness. We don't want to see an increased incidence of alcohol abuse or drug abuse or even suicide as a result of all this. We want to see people empowered and robust and getting back to work and getting back to their lives. And that's just as important to Ballad Health as a partner in this community as anything else. With that, I will, is that the last question?
Yeah, for Blake, yes, we have 2 more reporters
Oh,
online.
go ahead.
Thank you, Blake. Next we have Tim Dotson with the Bristol Herald Courier. Tim, do you have any questions?
Hey, yeah, just one question. And again, I know that the specifics and more information about Virginia elective procedures will be shared later in the week, or we can expect that in the future. But at this point in time, is there any sense of what kinds of procedures might end up being prioritized as we head into this process and start thinking about resuming some of these surgeries?
Well, I'd prefer not to speculate, and I'd leave that to our doctors and nurses and them to go through that. And I certainly, and I think Eric would agree with this, I'm very eager to follow their guidance and to see what their guidance is. And then we'll make a decision once we have their guidance. But I want to let that process work.
Thank you, Tim. And then our last reporter on the line is Scott
Wait,
Robertson. With
I think you had a second. Oh, you only had one.
only had one,
Yeah,
yeah.
okay.
Our last reporter on the line is Scott Robertson with the Business Journal. Scott, do you have any questions?
Yes, thank you. Alan, what insight can you give us into the administration's decision not to include Sullivan County in the reopening with Ballads? Was that discussed with you all, and what insight can you give us?
Well, I think that just relates to how the political subdivisions are done in the state. I think Sullivan County is a metropolitan area under the law. And so I think there's certain authorities the Department of Health has. I can't really answer the legal issue there. I'm certain that the governor is having dialogue with the leadership of Sullivan County, and certainly we would respect whatever decisions the leadership of Sullivan County want to make.
Scott, do you have an additional question?
Okay, thank you.
All right. Well, thank you all so very much.
Thank you.
Today's